tissue processing.
It's a science fiction movie, for now, but this Fifth Element scenario might become reality sooner than expected, thanks to 3D printing. And today, the world's leading doctors are using 3D technology to tackle virtually every aspect of medicine.
3D printing is a game changer here. I see it being efficient, quick, and allows very detailed customization of cells and organs.
Our long-term goals are to change the way that clinicians practice.
Progress is well underway to achieve the ultimate goal, printing living organisms, including much-needed organs that can be transplanted into humans, bringing sci-fi full circle.
Told you. Perfect.
I'm Dr. Benasser, and my lab makes ears.
At Cornell University in upstate New York, Dr. Benasser and his researchers have discovered how to print living cells that can be used to reconstruct tissues in the body.
The process starts with a scan of an ear. We sit someone down in a chair, and we have a camera that spins around their head and takes a 3D image of their head. We then can very precisely map out the topology of the ear. The next kind of key step is developing the ink for this printer. This ink is actually a living ink. It contains living cells. It's alive when we put it into the printer. It's alive when it comes out of the printer.
The Cornell team is already printing ears. Clinical studies in humans and ultimate implantation could be just a few years away. Meanwhile, at Mount Sinai Hospital in New York City, a team of researchers is taking 3D technology a step further. They aim to transplant a bioprinted trachea, more commonly known as a windpipe, inside a human body using stem cells.
Our goal is to be able to bioengineer a biological trachea that will serve to replace segments of the airway in patients.
Step 1, the scan. Step 2, a computer-aided virtual animation. Step 3, the 3D printer receives that animation as a digital file and prints it in a matter of minutes.
A 4 to 5 centimeter segment of the trachea could now be printed theoretically in about 5 to 15 minutes depending on the detail that you incorporate and the type of printer. So it's rapid, it's efficient, and the biomaterials that we're using are fairly inexpensive.
Today, when a patient has a diseased trachea, it's replaced by a tube, allowing them to breathe but not to speak. This advancement, which is now being tested on animals, will change all that.
It's a process that I think will see exponential growth in use in the next few years.
Across town, surgeons at NYU Langone Medical Center are already making the most of 3D printing technology as a means to plan and execute their pioneering facial surgeries. 3D printing tools, in fact, allow them to perform what they call jaw in a day.
So you can see that red thing that looks like a kidney. So that's a tumor. And if that's not removed, these things will get to astronomical sizes. So what we'll do is we'll plan how we're gonna remove it. And you can see those green lines there. That's where we plan to resect the jaw, take the jaw out. So what'll happen is based on the technology, they will computer generate these splints, which we will take to the operating room.
Once they agree on the surgery to be carried out, the tools are also 3D printed, accurate to the millimeter. Debbie Casada is a beneficiary of the 3D-aided surgery, having had both of his jaws removed due to infection. A couple of years later, all is well.
Yes, I run, I jog, I work out, I play, I live a normal life. I got no complaints.
Because we'll be able to be more accurate, and because we could spend less time in the operating room, we then are able to get a better outcome and a better appearance.
Dr. Levine's enthusiasm for the potential of 3D technology is shared throughout the medical community.
This technology is limitless. It's the only thing that's limited is our ability to think about new applications for it.